Well, good afternoon, everyone. It's Pete here for the Pain Toolkit. Hey, listen, got one of my very good friends here from the pain world. Good afternoon to you, Sam.
Good afternoon, Pete. Thanks so much for inviting me to do this video with you, but also really to take part in the conference that's coming up in October. I'm really looking forward to it.
Can you introduce yourself so the listeners and viewers will know who you are?
Yes, so my name is Sam Ahmedzai. I'm a retired medical doctor. I was professor of palliative medicine in University of Sheffield, but I'm now retired from my clinical work. But I've carried on with my research, my teaching, and particularly my passion is working with the British Pain Society. So that's what I want to share that with your audience right now, please.
Okay, well, Sam, can you just briefly, I don't want you to tell people, don't spoil the conference, the presentation for the conference, but can you just briefly tell the listeners and viewers about the BPS and the benefits, I guess?
Yeah, thank you. I love talking about the BPS. It's the oldest pain organization in the world, founded nearly 60 years ago. It's one of the largest national organizations. We're also part and affiliated to the European Federation of Pain Organizations and with IASP, which is the international one. But our organization is what we call multidisciplinary. It includes not just health professionals, but also psychologists, social care, pharmacists. We have doctors and nurses, of course, but physiotherapists. But very importantly, we now embrace patients. We have we have two committees, and the one I'm working with mostly is called the Patient and Carer Committee, EPIC for short. And there we've got a group of mostly patients, but one or two retired health professionals like myself and a researcher as well. Um, and there we're looking at the whole agenda of what the BPS is doing, but from the patient perspective. So if I can tell you the sort of things that BPS is now doing, we have a new strategy, and I'll share that when I give my presentation. But one of them is improving and increasing the amount of person-centered care in the care of people with chronic pain, also acute pain as well. So it's focusing on what does the person need, what does the person bring to the consultation, to the treatment room, or what can the patient do for themselves. So this is why I'm really pleased that you've asked me to talk about this when we're talking about supported self-management. Supported self-management is one of the main platforms that we are working for in the British Pain Society.
Mm.
Of course, we're also dealing with medical treatments, injections, psychological treatments, but we're increasingly focusing on what can people do for themselves. And not just patients, but also families as well. How can people work with their families? So that's why we got it's called the Expert Patient and Carer Committee.
Well done, Sam. Well, thanks very much for giving us a bit of a brief overview of what's about the BPS and what you'll be presenting on the 18th of October. So come along to register, and if you can't make it, don't worry. If you can't make that day, don't forget the conference will be recorded, and everyone who registers will receive the video recording and also the audio version as well. So, Sam, we'll see you again on the 18th of October. And thanks very much for watching. Hey, Sam, have a nice afternoon, man.
Thank you very much. Look forward to seeing you again soon.